what about safety of this bimodal therapy? One of the biggest concerns would be the development of hyperkalemia. We know that ACE inhibitors, by blocking aldosterone, will cause us to lose sodium and hang on to potassium. And we know that spironolactone will do the same and clearly increase in the number of hyperkalemic patients in human studies where they've used the combination of an ACE inhibitor and spironolactone. So we'll look a bit the data we have on that in dogs. This is a study that came out of the University of Georgia. These were dogs with asymptomatic microvalvular disease, 50 of them, 11-year-old dogs with normal renal function. They were treated with spironolactone at 1.5 mg per kg twice daily. So that's about 50% higher than the recommended dosage. And they received an ACE inhibitor, either benazepril or enalapril, at the respective dosages. And we'll just make short shrift, but they were followed out to greater than 20 weeks. And you can see that potassium levels were basically unchanged. There may be a slight drift upward, but certainly not significant. Magnesium levels, which are probably equally important, didn't rise very much at all. To my eye, they rise less than these. This one turned out to be significantly elevated, but none of these were thought to be of clinical relevance. Not any of these 50 patients developed electrolyte abnormalities that were of concern. The last of these I'll show you is not published. It's been submitted. It was 221 dogs from the prilactone study, the majority of which have mitral-valvular disease. There was no difference between groups in terms of the number of adverse events, including hyperkalemia. They had both about 200. There were actually more in the, slightly more in the control group. Cardiorenal mortality was greater in the control group, 29.5% versus 12.8% in the spironolactone treated group. So these drugs would appear to be safe for us, and they've been proven to be safe mostly in people.